You're watching KGTX 7 News, Galveston County's source for trusted local coverage. Live, local, and late breaking. This is KGTX 7 News.
Thank you for joining KGTX for our special segment. Students for Patient Advocacy Nationwide are here to join us and tell us more about their organization. Shout out to Walding Station and Main Street Bistro for hosting us tonight. Tell us more about SPAN.
So SPAN, or Students for Patient Advocacy Nationwide, is a student-led coalition dedicated to making reforms in patient healthcare in America. So we are a collection of students from across the United States dedicated to impacting local legislation and legislation in our states and the nation. So we do this by equipping students with the means to actually make this change. So on our website, spanationwide.org, we provide things like policy templates, letters that they can actually fill out just with their name and then sign it off. We have it all fitted for the standards for each state, and all they have to do is just send it off. So any patient, any student, anyone really can advocate for patients in their own right and help their friends, their family, and anyone really who they care about through this means. So they can actually submit these proposals on their end. We've outlined all that on our website.
When does SPAN expect to see change?
So we actually already have made change in 17 legislative pieces across 5 states. We do this by either supporting if amended, or opposing them. For example, there's a bill from Ohio 137. This bill is explaining that if a patient comes in with an overdose relapse, we send them back home with Loxstar, or like these overdose medicine that helps them not overdose in the future, or equips them with the possibility of, if they do relapse, they have the medications to make sure that they don't have to come back in the hospital and they're saving their lives. So this bill is actually helping Ohio because Ohio is one of the largest relapse in the country. So this is basically equipping these patients with these needs that they can save their lives in this situation.
So you mentioned other states. So does SPAN expand on expanding to other states and allowing membership from people in other states?
Of course, actually, we already have members from other states. One of our executives, Benjamin Kurian, he is from Columbus, Ohio, and he is part of our executive director team. This also includes Cheyenne Sakib here from Houston, Texas, as well as Joel Blessing from Houston, Texas. Now, we have opened up membership to everyone in the country. We want as many people to join as possible because we want to basically equip the largest amount of people as possible with the tools to make change. So we have students from Pennsylvania, we have students from Massachusetts, we have students from Atlanta, we have students from Michigan, and we have all these people making change in their respective states, spreading the message to people in their communities and in their cities. So we want to be, as SPAN says, we want to be a nationwide organization. And we really want to impact as many people as possible because there is strength in numbers.
Why should people care about SPAN?
Here at SPAN, we truly believe that there is a strength in numbers. So when we are coming in through as a group, we're equipping these patients with accessibility to make these changes together. Whenever we're actively changing the legislation, we're doing it in a group, so it becomes a bigger notice. Once you've taken care of your own health and your own access, you're able to make these changes because you're standing up for yourself. SPAN equips these people with all these kind of proposals, amendments, and the ways that they can actually react to legislation and make a change. So at SPAN, we're believing that in numbers, we can demonstrate giant leaps to ensure their health and patients.
All right. Thank you so much. Yes. Thank you for watching our special on KGTX. This is Leela Sims signing off.